But first, I'd like to present our presenter, Steve Pressment. He's the founder and president of Practice Perfect EMR. It's essentially his brainchild. And he's going to be walking us through some of his favorite reports today, some of the reports that we feel your clinic can really benefit from running. So these are all a part of the software that you're already using. So hopefully you can take away some tidbits from this. A couple housekeeping items. So first and foremost, the microphones have been muted and the webcams will not be required. The presentation is going to run for approximately 45 minutes, and there's going to be a Q&A session towards the end. So we've cut out 15 minutes for the Q&A. May run a little bit longer, so if you have some time, you're more than welcome to stay. But since the webinar is being recorded, it's going to go up on our YouTube channel afterwards, so you'll be able to catch everything there. Please type any questions that you have in the chat. We'll do our best to answer them during that Q&A session. And if possible, let's try and limit them to reporting questions. Since that is the subject for the webinar, we just want to stay on topic. And as I mentioned, it is going to be posted on YouTube afterwards. We're going to send an email with a link to the webinar. So if you or a friend wants to watch it, if you weren't able to make it or stay for the entire thing, you'll still be able to see it there. But with that being said, I'm going to turn it over to Steve.
Hello, everybody, and thanks for joining. Thanks for taking out the time today to join us, and hopefully you'll find this informative. A couple things I just want to add to some of the housekeeping stuff that that Matt had gone through. Again, we'll try to get to all the questions. Some of them might be very specific. We may have to redirect some of those to our support people, but we'll see what we can do. We're going to break down the reports into a couple different categories. We're going to talk about sort of cash flow reporting, daily reporting, weekly reporting, monthly reporting, and reports on demand. There's lots to go through. It's very difficult to kind of, time these things out and figure out what's going to fit, what's not going to fit. So we are going to try and get to everything that we can. It's going to be a quick one, a bit fast paced. Again, we are going to record it. So hopefully if there's something you missed, you can go back and look at it again or ask us after the fact as well. So a couple things I want to talk about just before we get going. One thing I want to mention is we're trying to do more and more of these seminars. If you have ideas for these seminars, things you want to see covered, things you want us to go into more depth, perfectly fine. Send in your ideas to Matt or to myself. Matt at practiceperfectemr.com, Steve at practiceperfectemr.com, because we like doing these things. It's a good way to engage, and we find that people do walk away with some kind of cool nuggets of information. Again, on that topic, some of you may find some of this repetitive. Some of you may already know about these reports, so I do apologize for that. We don't know what people don't know. It's a constant challenge with doing what we're doing, so hopefully you will find something of use in here as well. Two things I want to point out to you. Just very quickly, I'm going to just change screens here. We have a suggestion box a lot of you may not know about. I'm just going to show you where it is. If you go to our website, www.practiceperfectemr.com, there is a Contact Us button. In the Contact Us area, there is a suggestion box link. Again, where am I? Practiceperfectemr.com. Contact us. Click here to send us a suggestion. These actually come right to me. So feel free to send suggestions in. We do reply to every single suggestion. It may not be the reply you want to hear, but we do reply to them. The other thing I want to point out to everybody is this website, www.practiceperfectemr.com/releases. Again, hopefully most of you know about this, but all of our new releases are posted on here. You can see when a new update was released. You can see what was in that particular update as well. And you can even sort it by category. I want to see all the things that have been changed about reporting. I want to see, only the things related to clinical notes, whatever the case is. So again, www.practiceperfectemr.com/releases. Even if you don't have an update, you can go and see what's on the updates. We do encourage everybody to keep up to date as much as possible with the updates as well. Okay, I'm going to jump into Practice Perfect here. And we're going to start with what we call the cash flow reports. Cash flow reports have to do with money that is owed to you money that has not yet been billed, and client statements, always a hot topic. One thing I want to look at before we even get into the cash flow reports, I'm going to make this very quick, is something called the contact log. I don't know how many of you are using the contact log. We hope you are all using the contact log. It's this little button right here. I'm on Macs. The contact log is where you can make notes about conversations with or about the patient. For example, I can say that I made a collection call today. I spoke to the adjuster, and he promised to call back in 1 week, that sort of thing. And we can put a follow-up date in here as well for the 1 week, 3/22/24. And it becomes part, we can create a reminder if we wish as well. It becomes part of their history. Now, why am I talking about the contact log? Well, it's going to come into place a little later on, when we talk about running tasks that are overdue. And how this shows up on the receivables reports as well. So I just want to bring that up again, a little phone icon in case you guys aren't using it. Okay, let's jump into our reports. We're going to start with our financial reports. We have two, accounts receivable by invoice and accounts receivable by service. So what are the difference between the two of these? Accounts receivable by invoice, these are for full claims or invoices that have gone out the door. It may be for 10 services, maybe for one service, but it's basically if they've gone out as a group together, either as an invoice or a claim form, this report shows that submission in total what's overdue, whereas accounts receivable by service shows individual services that are overdue, not by invoice. What's the key difference? I find with our Canadian clients, this is much more useful because typically things are being billed by invoice. For our American accounts, typically accounts receivable by service is more important because the insurance companies don't really care if you send 10 things on one claim. They're going to pay one service, they're not going to pay another. So just to take you through these, if you're not using them, accounts receivable by service, right off the top here. These reports have very similar options. Just to take you through a couple of them, we only want to see people that are maybe over 30 days overdue. I only want to see clients that owe me money. I only want to see me insurance companies that owe me money. I only want to see insurance companies that owe me money, but I want it broken down by client or by payer. So either I want client listed with all the insurance companies, or I want insurance company listed with all the clients. So there's many different options here. I always stress to people, none of the reports in our system close out a period of time. There's no harm other than killing some trees in trying reports, running different options, and seeing what they're giving you. There is no harm in that. You're not going to do any damage by running a report. The worst you're going to do is take a bit of time, and that's about it. So I'm going to run the unpaid services accounts receivable by services report. I only want to see things that are over 30 days overdue. I don't want to see client notes, but I do want to see any collection-related comments that we made in that contact log that I just went through. So if you remember a moment ago, I went in and I said, we spoke to the adjuster and he promised me money in a week. That's what this relates to right here. I want to see my collection comments on here. And what this report is going to show you, and I suspect a good number of you are running this report. It's a very, very popular common report. This report is going to show you basically every charge that's overdue. So we're going to see each patient here. We're going to see Max. We're going to see each one of Max's charges. In this case, they're going out to Blue Shield or Blue Cross, what the charge is, the total amount, the client's balance, how much the client's paid, how much the payer's paid, predictive amount. We're going to talk about it a bit later on, time permitting, how much has been adjusted and what the current balance is of each individual charge, along with the aging for each charge. This charge is 1,500 days overdue, very, very overdue. Up here, you'll see all those collection comments that I made. Spoke to the adjuster. So you can actually use this as a collection document and see the history of the conversations you've had either with the patient or with the payer about the accounts. Instead of having to go back and forth between screens, I can walk away with this report. I have everything I need to know to be able to do my collections. The accounts receivable by invoice, basically the exact same thing. Don't have to go through it. Same options and the same results exactly. A very, very crucial report is something called the unbilled services report. Now, what are unbilled services? When a charge is entered into Practice Perfect, it's an unbilled charge. What that means is it's kind of sitting in this big bin of charges that have not yet gone out the door. So the charge is sitting on a patient's account, but it maybe hasn't been invoiced to the patient or hasn't been invoiced to the payer or whoever it happens to be. You've probably all seen this report as well. This is a report we recommend you run, oh, I'd say weekly, quite frankly, just to make sure you're not forgetting to bill somebody. There's something that has been added to this report a bit more recently that I do want to point out. And again, what we're seeing here is I'm seeing every individual patient, every date, every service. These are charges that are waiting to go out the door. They have not yet gone anywhere, which is not good. We have $94,000 in charges sitting here that have not gone out the door. So the insurance company doesn't even know that they owe this. We added something called an unsigned column. What that means, if there's a little X in here, what that means is that these notes are not signed. The notes for these days have not been signed. Again, why are we doing this? Because if anyone ever comes back to you and you're audited and they want to see the notes for any particular charges, or you want to make sure all of your notes are signed before they go out the door, it's an option that can be turned on. But this is just another warning to you that there are notes that need to be signed. And again, I believe there's actually an option in here where we can only show the unsigned charges. So I just want to see the charges that are unsigned, which is another way of looking at this. And again, there's other options for this as well. Other ways of looking at this we'll come back to, but that's a new column. That's what that means. That's what unsigned means. It means the note for this particular day, the daily note, the soap note, whatever you're using, has not been signed. Next thing we want to talk about when it comes to cash flow, a very hot topic is statements. Everybody has opinions about the way our statements look, good, bad, and ugly. No two people seem to want the same thing. I would say the statement format is something where we get more comments than probably any other reporting. And again, we are open to suggestion. If you want to send in some ideas about the statements and what they should be showing, we're happy to address them. But what we ask you to do is send in suggestions with a sample. Like people say to us, well, I want to see more detail about what the payer is paid. Well, that's great. How do you want to see it? How do you want to see it that it's meaningful? Where would it go without sort of disrupting the current format of the statement? So we do welcome input for the statements. But again, it'd be nice to have some ideas about how you want to see these things. So I want to talk about a couple things with statements. First of all, with one of the newer releases, you can now mass email your statements to your patients. So yes, you don't have to do them one by one anymore. I can say right from here, can you please show me this little flag icon? I'm on the client listing here. Can you please show me all of my patients that have an email address present? Okay. So what this means is flag all of my clients that have an email address on their file. And you're going to see a little red flag next to every single patient that has an email address on file. I can then come into my statements, either one of these, and there is an option to email, which means that the statements for all of these patients will go out the door via email without you having to sort of go in and do them individually or print them, that sort of thing. Conversely, I can come in here and I can say only show my patients that don't have an email address and I want to print them, that sort of thing. There's only 21 of them. Again, if you want to speak to support about this, if I'm going a bit quick, I want you to know the ability is there to do this and then be able to ask the questions. So that's a key thing. I do want to show you a bit about what some of these, the new statement, the little red ones, these are our newer version of the statements look like, and some of the options available on here. And again, hopefully this is repetitive to a number of you. And I'm going to just go back in time here and run a statement for Max Aaron here. Lots of different options on here. We'll talk about some of them. Typical statement looks like this. We want to go back maybe further in time here. Hold on, let me go back way in time and see if that looks a little bit better. There we go. So again, typical statement looks like this. We have this second page, which you can turn off or on. There's an option that's called turn off the tear off or the tear off reply section. In this case, we're showing NPI numbers or license numbers for providers. We're showing detail of when the insurance company's paid. or adjusted the charges. So the patient, if you want them to see it, they can see when payments were made by the insurance company, how much they paid. They can see how much the insurance company's adjusted. It's a running balance for the patient. So the patient owes $25. They can see all the payments that were made, to what dates those payments were applied. In this case, we have a guardian situation. That's a sample of what these new statements look like. Lots of options on here. I don't want to see all the insurance and adjustment payment detail. I don't want to see fully paid services. I don't want the tear off reply section. I don't want to see a total for the day. I want to see each individual CPT code or service charge that we levied. I don't want to show any information about the therapist that did the work. So there's all kinds of options on here that you can play with to make these a bit more friendly, a bit more relatable, a bit more clear for the patient. And again, what we encourage people to do is play. Again, try these different options. You're not going to hurt anything by trying different options in a statement. So again, suggestions for statements, we welcome them. Play with these new ones. They're not so new anymore. Any questions about the emailing, please let support know. But a lot of you haven't tried these new formats, because we do get a lot of questions. People say, can I show this? Can I show that? And they are available in this new little pink format down here. Okay, we're going to quickly pivot over to daily reports. And daily reports, basically the purpose of the daily reports for the most part is what I call matching and verification. We want to make sure that the things you've entered for the day are right. You haven't forgotten to enter anything. Everything kind of matches. If you do reports on a daily basis and match them up and make sure everything is okay, then monthly they'll be fine. You don't have to scramble the end of the month or the end of the week. So there's 3 reports on here I want to talk about. The first one, hopefully you're all running, is the daily reconciliation report. It's under reports, operations, daily reconciliation report. And the daily reconciliation report basically is a recap of any days you want. It can be more than one day. The intent was to use it for one day, but you can run it for any, I want to check the whole week. And there's a couple key things on this report. The first part is provider and attendance summary. That's fine. That's nice to see. But there's really 3 things at the bottom here that we look at. Number one, here's patients that had a balance today that we did not collect money on. We have Max and Carol. They owe us money. We let them walk in the door and they didn't pay us. Now, I could just as easily have run this for tomorrow and seen who's coming in the door that owes us money as well. This is probably the most important section right here. The following patients may be missing charges for today. This is a list of all patients who are on your schedule where charges have not been entered. Pure and simple. They came into the clinic and no one entered a charge for the patient. Maybe you're going to enter them tomorrow. That's fine. You can always go back and rerun the report for today. This is money that's just flowing through the cracks. Charges that did not get entered. That's probably the most important section of the report. And lastly, and this again more for the American side of things, is billing and scheduling time discrepancies. Patients who were scheduled for one amount of time but were billed for another amount of time. Now, in this case, they weren't billed at all. Let's say Max was scheduled for 30 minutes, but was billed for 60 minutes. That's interesting. Insurance company's not going to like that. Let's say Carol was scheduled for 30 minutes, but only billed for 15 minutes. Well, are we giving away money? So this is very important as well to indicate, again, are we accidentally overbilling? Are we accidentally underbilling? Again, more for the American side of things, but very, very important information, all built in. We encourage people to run this as well every day. Again, and no harm in playing with it. A couple other reports daily that are very key. And by the way, just to recap, that was under reports, operations, daily reconciliation. Another very key report is something called the payment journal. Very simple report. This is simply a list of, whoops, let me put whatever data I want in here. This is very simply a list of all deposits made on a given day, checks, MasterCards, Visas, whatever it happened to be. Why do we like to run this report? At the very end, it shows how many, direct deposits were made or how many checks were deposited, how many MasterCards, how many Visas. You just want to make sure this balances. You just want to make sure that whatever this report says you deposited into the bank or processed through your credit card machine, just using the summary down here, matches exactly what went into Practice Perfect. And why do we do that? Well, let's say I paid the clinic $100. They forgot to record it. The clinic phones me a month later and says, where's your $100? And I say, but I paid you guys. It's bad blood all around. So payment journal, very quick, very simple. Just make sure that it totals at the end of the day, the end of the week, whatever you're using. The details are here. The summary of payment methods is here. That's really all you need on this report. This other stuff is interesting information, but really it's the summary by payment method that's kind of key, and the actual details of what was deposited. So something that we do recommend that you do as well. The last report I want to run through, not really a daily report, but something that I do think people aren't using to its fullest. Under reporting, by the way, again, just to recap, that was under reports, finances, payment journal. Under reports, finances, payment application report, a very, I think, underutilized report. There's a lot of information on here that shows you not just the payments that came in, but where did they go? Were there discrepancies? That sort of thing. So I'm going to run this report again back in time just for a couple days. I'm just going to use all the default options. There are different options that you can run here to filter by insurance company or to filter things that didn't quite match up, all sorts of different things. But I'm going to run it this way. And again, what this report shows you is not just the money that came in, but how was it applied? So for example, we're going to take a look at, let's take a look maybe at Margaret here. So money came in for Margaret, $205 came in for Margaret. The original amount was this. The amount applied was this. We have a column called discrepancy. Now, discrepancy shows you if something was short paid. So here we have a $6 short payment. Here we have a $47 short payment. This is very interesting because people don't necessarily catch these things. In fact, what I think I'd like to do is actually have the zeros not even show up at all here because it just kind of detracts from the report. But people aren't aware of this discrepancy column. And people always say, well, how much money do we get in for the services that we've performed? So this is very, interesting information. We can see if there were discrepancies right off the bat. The very bottom of this report, there's another interesting bit of information here. It's going to show you for each individual code that you're billing. Again, there'll either be treatments for Canadian accounts or CPT codes for American accounts. It's going to tell us that for 97001, we collected on 8 units. The average was $72 a unit. The average was 11 visits, and we got it in 56 days. Now, this is interesting. So if you want to know how much you're getting paid by fee code, how long it's taking to get paid, what's the average amount you're getting paid by fee code, this is kind of interesting information. And then here's the total amount we've received, based on each of these things. Not how much we billed. This is how much we actually received during that period of time on each one of these charges. What's nice about this is we can then say, well, you know what? I got to renegotiate with Blue Cross. What are they actually paying me? I can run this over a vast amount of time for one particular payer. And now I can see that for Blue Cross, we're getting, I don't have a lot of data here, but I can say they're taking an average of 35 days to pay it, and they're giving us $14.52 a unit on average. So it's very interesting information that I don't think a lot of people are using. The last thing I want to talk about with this report is we get a lot of times people ask us, I want to see everything we received in January for charges that we made in that were levied in December and November. Well, we do have an option to do that in here. I can say, for example, I want to see everything that we received in January, but only against things that were billed, for example, in December. I'm not sure if we're going to have anything in here. But again, this is an option in the system, so you can see sort of what was paid from last month. And let's see what we got here, if there's much. Yeah, there's some stuff in here as well. So these are only going to be things that were paid in January for services that were levied in December. So interesting information. How much did we collect on last month's charges alone? And that's it. Same information appears. So again, just to move on, I'm just wary of the time. That is under the under finances, the payment application report. And again, I've said this a bunch of times, feel free to play with this report. There's no harm in running it. You're not going to break anything. Okay, moving on to what I call the weekly reports. Those are the daily reports. Payment application is not really a daily report. You can run whatever you like. Weekly reports. So these are reports that we think you should be running weekly to get various information out of the system. The first one is something called the funding report. Hopefully, a lot of you are running this report as well. This one can be run by provider. This is a report that shows you who's running out of authorizations. I want to see all of my patients that have less than $500 in coverage left. Maybe I just want to see a certain payer like Medicare or an auto insurer, that kind of thing. I can see people that have less than a certain number of visits left, people whose coverage is ending on a certain date. So this is all who is running out of their approved treatments. And again, as a provider, I can run it just for me if I want. Let's see if I can do that or not, if any data shows up here. And what this is going to show you is all of your patients, their original coverage and how much is remaining. In this case, they haven't used any of it. But basically what it's going to show you is who is running out of their coverage, who is actually coming up on the end of their coverage. And if you got to do the dance and get more authorizations, this is a way to do it. So we call this one of the weekly reports that we like to see run, so you're not surprised. And again, that was under the operations funding report. We're going to take a look next, a very crucial report, the patient fall off report. I hope everybody is running this thing. Can you please show me all of my patients, my active patients, my non-discharged patients who haven't been here since the beginning of March, 2 weeks. I can run this by therapists, that kind of thing. And what this is going to show you is everybody who hasn't been in for that period of time. So I have 4 patients. Here's who they are, why they were coming in, who they were seeing, the last person they saw, some of their history. These are 4 patients we have never discharged. We've never said you're done. We've never said don't come back, but yet we haven't seen you for 2 weeks. So what are they doing? Are they out saying nasty things about the clinic? Are they feeling better? This is crucial information. This should be run once weekly. Patients should be contacted or discharged. If they're not coming back in, they should absolutely be discharged. One thing I do want to specify here, a bit of a sales pitch. The wired client, which hopefully most of you have heard about, that's our automated texting service, does this automatically. You can automatically, without you doing anything, have your patients who vanished texted to ask them how they're doing, do they want to book another appointment, and encouraged to call you. So that's, you can totally automate this process with a wired client. Again, if you want any information about that, just reach out to Matt or myself. Next report we want to talk about on our weekly reports. As you may remember, we talked at the very beginning about the contact log, where we could make notes about conversations with follow-up dates. Under reports, tasks, there is something called the contact log follow-up report. Can you please show me everybody who has broken a promise? And I just want to see collection-related promises, for example. And this is going to show me everybody who has blown by their promise dates. So Max has a whole story of broken promises. Carol has a whole story of broken promises with the collection. So what we're seeing here basically is a list of all of those tasks that have a follow-up date that did not get completed, because you can complete an item. Once it's been completed, it comes off the list. It stays on the list, but it comes off the report. So contact log follow-up report, very, very key to be able to follow up on whatever tasks you need to follow up on, whether it's collections, you can define those categories. And we can, a lot of people do this for, I'm waiting for paperwork for clients. I have a category called paperwork. Show me all the clients whose paperwork has not come up yet. By the way, there's lots going on in the chat. I can see we are going to try and deal with Q&A all at the end if we can, just to not make this disjointed. So I do see these messages are building up there. We will get to all of those. So again, that was under the tasks, contact log, follow-up report. In the same category, there is something called document and progress note status report. This is, again, for those of you using the system to do daily notes. I want to see all of the notes for the month of March for myself, for somebody else, that are neither completed or signed. So these are all of my notes that are outstanding. I have 2 providers here. I didn't run it for each provider. I ran it for all providers. I have 2 patients under Herb. Here's the description. It's a document or a daily note. It's either missing or incomplete. So this is a list of all of your notes or documents that have not been completed and signed. Again, you can run it for yourself. You can run it for everybody. Just to do a recap: reports, tasks, document and progress note status report. Pretty key to collect or select the right status. You want not completed or signed generally. That's going to catch everything that hasn't been done. There's other options here, but that's really the one that you do want to use. And again, it can be run for an individual provider. Now, a little preview of something that's in the next update that you're going to like. We get this all the time. I don't want to run a report to show me the notes I haven't done. I want when the system turns on, I want it just to show me the notes I don't have done. I don't want to have to go looking for it. Well, we have added something called pending tasks, which is in the next update that's going to be released probably Monday or Tuesday. Pending tasks, which you can have open automatically when the user logs in, shows every single note and every single document that the therapist has to sign, the therapist who's logging in. So right from here, instead of the therapist having to run a report and see what's not been signed or completed, they can come right into pending tasks, even have pending tasks open automatically when they log in. And right from here, they can basically go into each note and or document and sign it, and then it would come right off the list. So pending tasks, something new and exciting that almost replaces the report I just showed you. But a lot of people have been asking for this. We're also working on a dashboard next to show some similar kind of information. A report that you may not be aware of that I do want to talk about, and this has to do with sort of measuring your admin, I guess, compliance, for lack of a better description, is there is a report in the system called, where are we here? Missing information, client missing fields report. Under the marketing reports, marketing, client missing fields report. A lot of people don't know about this one. Reports, marketing, client missing fields report. And I'm going to run this one from the dawn of time to today and just see what we get here. I really don't know what we're going to get. I'm going to do by contact date because every patient has a contact date. This is going to show you every patient and any missing information on that patient. In this case, we have a lot of employer information. And again, a lot of you don't collect employer information. We'll talk about that in a minute. But here, for example, we're missing a family physician. We're missing an injury date. We're missing diagnosis codes. Two things here. First of all, you can define what's collected on this report based on division. This is getting a little deep in the weeds here. I can go here under contacts, housekeeping, contacts, divisions, and I can say for all of my Medicare patients, it's this little icon right here, required fields. I can say, I need all this information. I need all this info from my Medicare patients. I really need their birth date and their gender. I really need their description of their incident and their primary provider and their doctor and their referral source. I really need their diagnosis codes. So you can define based on division. I know this is getting a little deep into the weeds here. Contacts, divisions, little guy right there. I can specify again the fields that I want. And when you're running this report, the client missing fields report, that's what it refers to. It ties into those settings that you made. So this is a great way. And you can run this report, by the way, by user. So let's say you are doing a review of one of your particular admin staff. I can say, I just want to see, Danielle. And we can sit down with Danielle and say, look, Danielle, your data collection is not so great. So it's a good way of measuring the metrics for your page or for your admin people. And again, a lot of people don't know that this even exists. So pretty important thing. A new report that I do want to show you that a lot of people are not aware of is something called the compliance report. This is a patient compliance report. Are my patients living up to their treatment plan? I'm going to first of all show you where the treatment plan gets entered. We're going to take Carol. We're going to go into her incidents. We're going to go into treatment plan. Now, a lot of you know about this tab up here, but you may not know about this one down here, where I can say that Carol has been allowed 24 visits. She's allowed 3 visits per week. I want her to come in 3 visits per week, 2 visits per week, 10 visits per 30 days per month. It doesn't matter. So basically, visits allowed are 3 in 7 days. This is what I'm recommending. I want her to come in 3 times every 7 days, 3 times in a week. So we have our new report here called the compliance report. And the compliance report basically shows you this. I'm going to select only show deficient clients, means they're deficient in their attendance. And what it's going to show you is all of those patients who have a treatment plan. You've recommended 3 days per week. they're only coming in a quarter day per week or 0.75 days per, they're coming in much less than what's been recommended. And here's a deficiency in the visits. So this is basically a list of patients who are falling beneath their prescribed treatment plan. Get them in the door, have a chat with them, sit down with them. Instead of you having to figure out who's not living up to their treatment plan. I mean, it's one thing to catch patients who aren't showing up, the patient follow-up report. It's something else to catch these patients who are basically not living up to their treatment plan. They're coming, but they're not coming often enough. And this is a great way to catch them. It's a great way to get them in the door and, and basically get them back on track. So again, just another quick recap here. It's under the incident treatment plan tab if you want to put it in, and the report is here, the compliance report, relatively new report. A couple of the reports we want to run into. Let's get into sort of our what we call the monthly reports. We'll jump into those. We are beginning to run a little bit behind here. Operations summary. Now, again, the goal of these reports is just to see how you're doing. These are the sort of our metrics reports. Operations summary, hopefully you're all running. This is just a very high level look at the clinic. We can run it for any date range we want. This is basically, your revenue for the month all on one screen, a breakdown for each one of your therapists with new patients, discharges, visits, revenue collections, average per visit that the therapist is charging. Why are we seeing a difference here? Cancellation no-show rate by therapists on this report. Again, what are Daniel and Barbara doing the not so great compared to Herb? How much money came in during the month? Number of new patients that came in during the month, number of patients that you discharged during the month, or during whatever time period you want, why they were discharged. We're going to talk about that in a couple of moments as well. Unbilled services. Remember we talked about unbilled services way back, just to make sure your unbilled services are not getting out of hand. They should be billed frequently, and a bit of an aging summary. So it's just some of the key, really high level clinic metrics. Your revenue, your performance by your providers, the money coming in, the new patients coming in, the patients that are discharged, unbilled services, and a snapshot of your aging as well. It's a nice high level. How is my clinic doing? Almost like a dashboard. This week, this month, today, next, last Tuesday, doesn't matter, that sort of thing. So operation summary, again, where was that? Reports, operation summary, very, very popular report. We're going to take a look at a treatment statistics report, another one that people typically don't run very often. Treatment statistics report. This is very much based on the fact you are discharging patients. If you are not discharging patients, we don't know how long they're being treated for. We don't know their total cost because we don't know that they're done. It's very important to discharge patients when either they're not coming back to you on their own for their reasons, or you're discharging them for your reasons. You do need to discharge patients. If you don't know how to discharge patients, it's this little icon right here. Carol doesn't want to come in anymore. We have our little, where is it here? We're going to get into Carol here. This little exit door where we can discharge the patient. Anyway, you should be discharging patients, or these reports are not going to make a lot of sense. Treatment statistics report. I think this is kind of a cool report. I'm just going to run it as is. What this report shows you is a number of things. Each patient, their injury date, if you know it, their contact date, how long between injury and contact, how long between contact and assessment, and how many treatments they had, treatment dollars, how many weeks they were here for. So we have each patient listed. At the very end, we have some really interesting information. We have, out of the 368 patients you discharged, 40 completed treatment. That's only 10%. One of them, their funding expired. These are all definable categories. 101 vanished. 16 self-discharge. I mean, again, you can define these things, but this is really interesting information. If this is true that only 10% of our patients complete a treatment, that's not good. Again, this can be run by provider as well. So this is very, very interesting information about the success of your patients. Did 90% make it through treatment? Did 40% make it through treatment? And let's say that it is a low number and you find that there's a whole bunch of patients who are self-discharging. Well, that's something you got to work on. At least it points to you some potential weaknesses in the operation. Another very important section here, summary by number of visits. How many patients had no visit? 50% of our patients never made it through the door. They were referred, we entered them, they never came through the door. This is crucial information. How many of our patients are staying for longer than 6, 7, 8, 9, 10, 11 visits? Again, this can be run by patient type as well. We also get an analysis here about, based on injury type, For example, old ICD-9 code here, lumbar spinal stenosis. We had 17 patients. The average patient was here for 7.94 visits at a cost of $1,400. So when you're looking at what are the average number of visits that treatments that people are having, a number of visits, this is where we kind of get this information from based on injury code. Also right up top here, we have, the average numbers of visits as well here. Where are we here? Total number of treatments. The total of this would be the average number of visits as well. So we have all sorts of ways of showing how long people are staying. Are they leaving too early? Where are there gaps in your system as well? So pretty crucial information. I'm a big fan of that report. Another report to show you very, very quickly, referral trend reporting. Again, that was operations treatment statistics report. Under marketing, referral trend report. Again, something I don't think a lot of people are running. I'm going to go way back in time here very, very quickly. This report shows you, and again, we're going to base everything on contact date because everybody automatically has a contact date. You don't have to remember to enter it. So that's the most reliable. For any report that asks for referral, contact, or assessment, contact is by far the most reliable bit of information in the system. And this report shows you basically all of your referral sources down the side, the months along the top, and the number of referrals from each one of these referral sources. David Hubble here, 2421142. But then he trailed off the end of the year. What happened? This is a great way of identifying a negative pattern with one of your referral sources. They were doing great things and they started to trail off. Get on it before the damage has been done. So again, play with this report, marketing, referral, trend reporting. Very popular report. I'm going to address probably a whole bunch of questions with this thing right here. Provider performance summary. I always like to say that this is a report that provider performance summary. I'll do it again here. This is a report that owners love and providers do not. This is a nice detailed report that shows the performance of each one of your providers. Each provider, number of visits they had scheduled, number of hours that they're scheduled to work, number of hours they're not seeing patients, how many patients per hour are they seeing, client scheduled hours. This is key. What percentage of Daniel's time is spent seeing patients? Not bad, not bad. There's no real metric for this. People seem to think 75% should be the number they're going for, but this is really, really key. Someone's down at 30%, 20%. That's not, or sorry, right here, 44, 37. That's not good. Those are not good numbers at all. Yeah, the hours are the hours. So that's really the number you want to look at, the percentage of client scheduled hours, number of new clients they were assigned, change in client load, cancellation, no-show rates based on the therapist, revenue they generated. How many units per visit are they generating? Why is Daniel generating more, units per visit than say her? What is there some magic that Daniel's doing that's successful or not? How much are they generating per visit per hour? Great report. I'm going to sort of answer a whole bunch of questions probably with this one statement right now. We get all the time asked, where does this information come from? It doesn't make sense to me. It doesn't gel with my version of reality. Where's it coming from? We're going to release a sheet in the next week or two. We should have done this a long time ago that describes exactly where all this information comes from. So you'll be able to see, okay, this is where this is coming from. This is where this is coming from. This is where this is coming from. We're going to, again, have a cheat sheet that will be available on the web. That will explain all of that. So I know a lot of people are asking for that. Okay, we are up against the clock here, and there's still a bunch of reports I did want to cover off. So I'm going to try and do them really, really quickly. Compensation reporting, not sure how many people are aware of this, but you can set up compensation rates for your providers. If you're paying them a percentage of what they bring in, a percentage of what they charge per visit, per unit, that can all be entered. And then when payday comes around, you can report on that information. Just speak to support about where that gets all set up. It's under your providers. You can set up basically compensation rates for each one of your services. So again, just any issues about that, if you are paying providers that way, please speak to support. We can talk about that. There's a report called under Marketing Referral Association report. We looked at the referral report a couple minutes ago where you can see the trends month over month, what doctors referring what. This is a more detailed version of that. I can say, for example, that I want to see a much more detailed version of that. I want to see all of my referrals, again, by contact date for a certain date range. It'll actually show me for each physician exactly who they referred and how much revenue was brought in. So I can see, for example, that Dave Davis here brought us $670 in business. I can see that David Hubble brought us $2,400 in business. I can see that, grand totals down here, totals for physicians. So again, referral association report, where was that? So again, if you are going up to see one of your doctors or discuss all of the patients with a particular doctor, it's under Marketing Referral Association report. Hopefully you all know about this one. You can run your client listing right from here as well and export all this information if you want to do any kind of mass mailings, anything like that. Again, I want to reiterate with Wired Client, you can do blasts via text. We can see only patients with a certain birth date on this report. I just want to see my April birthday patients, and I want to send them a little letter. I want to export their list, that kind of thing. You can do mailing labels right from here. A lot of people don't know that we can still do labels. It's kind of an older thing, but people are still doing it. You can do labels for all of your contacts, physicians, other contacts. We have that little label icon there. And again, you can export all this information for any of these contacts to do mailings, that sort of thing, your payers included. One other report that I do want to talk about that I think is underutilized, and then we'll open it up to Q&A. I did rush through some of these at the end here. Very powerful report called the Find Appointments Report. You probably all know it's here, but there's a lot of things you can do with this that people aren't aware. This is basically a great way for you to analyze your attendance statistics. I can say, as an example, for all of my clients, for all of my providers, for any status, let's say from the beginning of 2023 to today, I want to see every single appointment that we have booked. Okay, here it is. I can see if they're on the web. I can only show the web one. So if you want to see if your patient portal is being effective, I can just show me the web booked appointments. So we can do all kinds of filtering here. I just want to see cancellations. I just want to see, no-shows. I just want to see clients who've had no services performed. Whether they never come, they never came in. Nice thing about this is the printed version of this. Again, there's more options on here as well. Is there is a nice little summary at the very bottom of this. It shows you how many completed, how many canceled, how many the therapist canceled. By the way, therapist canceled is a newer status, meaning that the therapist canceled the appointment, not the patient. You need an update if you're not seeing it on your system. A breakdown by color scheme as well here. So there's all kinds of information on here. One new thing, summarize, cancel, no-show reasons. You can now, on this report, see a total. How many patients were sick? How many patients, because of a snow day, did you lose? And this is duration, the amount of time you've lost. So again, the Find Appointments report, very powerful, right there. It's on a lot of the screens. It's probably, don't think it's on. Yeah, it's right here as well. It's on Find Appointments as well. Again, play with it. There's no harm in playing and playing with these reports as well. So the end there was a little bit rushed before we get into the Q&A. Matt, I'm going to ask you to maybe jump back in here and help me with the Q&A. I have a lot of sort of messages in my chat here. I haven't gone through them yet, Matt. I'm not sure if you've been monitoring them or not, but maybe you can unmute yourself, jump back in, and maybe help me navigate through some of these questions here.
So I'm here now, and we have a lot of questions that were also submitted when people were registering for the webinar. So thank you very much for that. I'm able to see those on my end, but it seems like a lot of folks may have sent you some questions directly. So you're welcome to read through those. But I'll start with some of those that were submitted previously. So are there any tracking tools for admin team KPIs? They're finding that they need to keep the team accountable and are unable to do so without hard evidence.
Okay, so we get this all the time. I want to track, are my admin people answering the phone? Are they returning phone calls? Are they, and some of this we can do, but some of this we can't. I mean, we went through with the missing fields report. We can tell if they're not entering information, but we don't know. Let's say they're answering the phone, but not answering the phone quick enough, or they're, things aren't being translated into patients being entered. We would love to track this stuff, but we just don't have a way of capturing it. Like, how do we know how fast they're answering the phone? How do we know if they're entering patients quickly or not? there's a lot of that we don't know. There are services out there that will actually do that, that do tie right into your phone line and monitor how many rings happen before the phone's answered, and how many, and how many calls go unanswered, and are they being answered quickly, and what's the nature of the call. But we don't have any way of tying right into the phone system to monitor some of this stuff. So again, suggestion box I went through at the beginning. If there's certain KPIs that you think we do have the ability to track that we're not, throw them in the suggestion box. We're happy to do it, but a lot of it is really out of our hands, or you're relying on the admin people to report, I answered the phone, where we don't really know if that's the case or not. So again, send them in. Anything you think we can do, throw them in the suggestion box. We're happy to take a look. But a lot of that kind of stuff when it comes to the first point of contact, which is what people are talking about, is really out of our hands. Again, when you're looking at collections, yes, we can run a report that says, who collected information, and who collected payments, who made phone calls, that kind of thing.
Um,
Matt, next question.
Got another one. So why does the AR report also include fees that have been written off?
It shouldn't. If something has been written off and the balance is zero, it should not be on the receivables report. So I'd contact support about that. Anything that's written off where there's a balance of zero should not be on that report. If you're seeing that, you should be contacting support about that.
What are some of the options when it comes to outcomes reporting?
So outcomes reporting, there's a couple of things there are a couple things we talked about. For example, in the treatment statistics report, you can see if people are sticking around, are they completing treatment, how long are they sticking around for? That's all in that treatment statistics report. What we're looking at actually doing is adding in some more reports that have to do with goal tracking. Here's what the goals were, and have they actually met the goals? What percentage of time have they met the goals? So that's another round of reports that we are looking to do. We'd love some input on that as well. But if that's what you're considering, sort of outcomes when it comes to goal tracking, yes, we have that in mind. If there's other things you'd like to track for outcomes, send them in. We're happy to take a look.
There was a question about support from Practice Perfect with reconciling Practice Perfect and other financial software in a clean way. Is there any accounting support available from people who are familiar with Practice Perfect?
It's a good question. Do we have kind of accountants that we deal with that understand what some of the reports mean and how to reconcile them? And that's something that I'm going to make a note of. We're going to walk away with, because we have a number of accounting people that do want to kind of work with us. And again, we also have our billing company. So Matt, maybe you can make note of where that came from, and we can kind of look into that one a little bit further.
Absolutely. Any options for tracking payments by date of service?
Again, try the payment application report, because that's exactly where was it here? Payment application report. That probably will do the trick with the hold on, let me just shut this thing down here with that date of service option. So the dates and the date of service. Try it out. If it's not giving you what you need, let us know and we can have a chat about it. But you may find the dates of payments combined with dates of service gives you exactly what you need.
Awesome. What's the best way to get a true patient visit average metric?
I would say the treatment statistics report, you'll probably get a good number from there, because it shows exactly how many visits the patient's made. Again, we can only look at discharge patients for that. If you look at a patient that's mid-treatment and start averaging them into their, the average number of visits, it's going to totally skew things, because a patient that's only started their treatments, it's going to look like they're not attending a lot at all. So that's really a number that's got to be based on patients who've been discharged, because we have the full picture, and that's what the treatment statistics exactly does. So I would play with this report, see if you're getting what you need from it. It does show the average number of visits per patient. You can break it down by payer and by provider and patient type and all that kind of thing as well. See if it's there. If not, if it's not what you need, let us know, and we'll see if we can find a better way of measuring it, but it's got to be based on discharged patients.
How do we get the unpaid reports, outstanding accounts as of last month, but include payments that have been made this month?
Okay, so you want an unpaid as of last month, but including payments made this month. I'm not sure why somebody would want to do that, to be perfectly honest with you. If the payments have been made this month and they're no longer outstanding, when you backdate a report, it's backdated as of that particular date. So it's as of, if I ran a report as of, let's say, February 29th, It's going to back out any payments that were made this month intentionally. Uh, Again, something that you can put into the suggestion box, but we want to know why you want to do that. Why would we want to show things that were outstanding as of last month that have been paid, this month because they're no longer outstanding? So we need a case for that, to be perfectly honest. It's not something that I don't think a lot of people would be looking for. But again, if there's a valid reason for it, we can certainly take a look at doing it.
Best way to see build time for a provider during a set period of time.
Oh, I would say the revenue report. We didn't talk about the revenue report, but that will definitely have that. That'll have every service they did during whatever period of time. The provider, you can pick up an individual provider. One of the columns on this report is duration. You will see exactly how much, assuming you've entered it properly, this report will give you exactly how much time that you billed during a specific period of time. And again, it's under the revenue report. You'll probably also find that on the provider performance summary, but not in as much detail. The revenue report will show you exactly each patient, how much time they spent on each patient with a total as well for any day range.
And the last one I have here is I'm interested in understanding what areas of practice perfect each line of the provider performance summary generates from.
Okay, so I mentioned that as well. We are going to be coming up with this nice little sheet. We get asked this all the time that explains exactly on this report, okay, where are you getting this from? Where is this number of hours coming from? Where is this number of cancels coming from? Where is the units coming from? So we are actually going to be releasing a sheet in the next week or two. And again, I apologize. We've been asked for this for a long time that shows exactly where each one of these numbers is coming from. So you can go back and take a look. The big one is this one here is the hours one. People don't understand if things like lunch, is lunch being counted, is lunch not being counted? So we are going to explain all of that.
Awesome. So we had a lot of questions coming through the chat. Some may have been directed to you specifically, Steve. So you'll see those in your chat. Our colleague Carrie, she's been doing an awesome job kind of replying through the chat as well. So thank you so much for that, Carrie.
Okay, thanks, Gary.
Yeah, and just one other one we got from Wes here. Is there any way to further group insurance companies based off of billing rules? For example, 8-minute rule versus AMA. We have different KPIs for our therapists. As of now, I only see a way to classify it by all insurances or by single. Is there any way to group or classify them?
Interesting. Other than division, probably not. Something we can certainly look at doing. I mean, we do have in the payers, again, especially when we're looking into the US, we do have sort of this whole a kind, we have TRICARE or Medicaid or commercial. So we may be able to leverage this. I wouldn't mind if that particular person can maybe drop me an email specifically and we can kind of have a chat about exactly what they have in mind. Interesting idea, but I wouldn't mind hearing more about it.
Excellent. That's all I see on my end, Steve.
Okay, I got a bunch on mine. Let's see what we can do here. Let me just sort of filter through it. I'm not sure if this is let's take a look here. Join. I mean, the patient didn't visit. Charge for copy that would show because for the what? Why does it sometimes show a missing charge for the day with an asterisk when they have been charged? You may be missing a visit number in the box. Okay, somebody answered that one. That's great. I cross-referenced the payment journal with the payment application report. I'm in error slips. Okay, good. That wasn't a question. And Carrie answered that. Sorry, I'm just sort of reading this live. What report do you compare the payment journal to ensure it matches? Okay, so the payment journal is the report. Oh, I think Carrie replied to that as well. Yeah, good. Carrie, you should run this. You should run these sessions. Is it confirmation date of birth? Oh, so we talked about that, the missing fields report. Question came in about missing fields, so that was addressed. Great. Once their progress note has been accidentally deleted, can we find it anywhere? I cannot find it in deleted items. Okay, in the, let me see if I can bring it up here. Under each client, the question was, how do I find deleted notes? I've accidentally deleted a progress note. If you go into your activities by progress note, just to backstep a moment here, Carol, there is a drop down for deleted notes. And there they are. And then you can retrieve them. So hopefully that answers this question. Why is the percentage no-show different on the operations summary versus the provider performance summary, even the same options checked. We'll have to check into that. I wouldn't mind seeing specific examples. So the question was, operations summary shows a percentage of cancel no-show, of call no-show. Provider performance summary seems to show, it shows the same stat, but it seems to be a different number. I would love a specific example of that, and we can look into why we've made a bunch of changes to provider performance that we may not have made to operation summary. So again, I would contact support in that case and say, look, I got two reports that are supposed to be showing the same thing, and they're not. Can we please look into it? And we will definitely look into it. So please submit that with examples directly to support. Will this recording be sent out to the group who registered for the webinar? The answer is yes, but Matt, is it something you post or something you send out? Maybe you can clarify that. Oh, Matt already answered it. Very good. Sorry.
Both.
I'm on PP version 634. I do not have a pending task tab, that new tab. That's because it's on 636, not 634. 636 will be released in about a week. We're just doing some more testing. There's a whole bunch of changes on 636, some interesting stuff. So Preet, just stand by for a week or two, and the reason I'm using it now, I was very brave. I used the test version live for a seminar, and it seems to be working well. Yep. Okay, very good. Who else do we have here? Carrie, you've been great. I found a deleted progress note. How do I get it back? Okay. How do I get back a deleted progress note? Again, if I'm looking at my deleted notes, which is on my screen here, I flag the one I want to bring back, and I hit that little retrieve button, and it'll bring it back into my active area. So that's how you actually retrieve it. And I think Carrie did that as well. I should be reading further down. Okay, good. Are we doing something about inventory and stock management in PP? Yes, we do have inventory control in Practice Perfect. It's not a very robust system. It's minor, but we actually do have inventory control in here. I didn't cover it today because so few people are using it. So Preet, I encourage you to contact support and they'll take you through it. There are reports, inventory reports. I didn't go through them just because it's not high demand, but the answer is yes, contact support and we can do that. Looking for a report that will return a list of, Carrie's answered this one as well. Carrie, we got to bring you in on these things more often here. Is there any way to further group insurance companies based off billing rules? But that came up to email me. And if a CPT code, okay, Paulo, okay. If a CPT code changed from 99097 to 9, do I make a new CPT code and leave it alone, or can I change the code to correct? A specific question, a CPT code has changed. I would add the new code, leave the old code in place so we have the old history. But again, I would take that. That's Lisa. Lisa, take that to support if you don't mind. But I wouldn't change the old code, or we're going to change the history on what's been built. So that would be my sort of gut reaction to that one. Do not delete the old code. Can remote access version be better for providers to use at home? The web version, we're always improving it. There's going to be more and more changes to the web version coming up as well. And that's all I have. Again, if there are any other, I should go back to my other slides here. If there are any other, I guess we don't have a slide with email addresses, Matt, I don't think.
We don't, but we'll include that in the email afterwards. If you have any questions, we'll include Steve's email there. We'll include support's email there. So feel free to get in touch. It's also going to include a link to the recording itself. But yeah, we'll be touching base with you afterwards.
And again, my email address, like right off the bat, it's just, and I can just send it on to whoever. It's either matt@practiceperfectdmr.com or steve@practiceperfectdmr. Can providers who are not working be removed from the drop-down provider list? Yes, you can. You can delete them and they don't get deleted. They're always in the wastebasket. So you can delete them. If you go into providers and delete them, their history will be retained. They can always be brought back. Interesting. Can the wire client be leveraged internally to remind clinicians to write reports after a defined number of visits? Not at present. They should be writing, like for example, after 10 visits, that kind of thing. Again, something that we are looking at doing as well. So not yet. Wire client can't do that yet. But something that we are considering. We have a whole bunch of plans in mind for wire client, including sending statements via wire client, outstanding balance things via wire client. We've recently added on the version you haven't seen yet, the waiting list. You can now text clients on the waiting list right from wire client. That's coming as well. Very good. We managed to squeeze it in sort of on time, even though we were a little rushed. I apologize if people felt that was a bit rushed, but it is recorded, and Matt will be sending it out to everybody. So again, I want to thank everybody for their time. Matt, thank you for putting this together, and Carrie, again, thank you for stepping in there. I think you saved us a whole whack of time, going through some of the Q&As. Sending a Google review through Wire Client. Yes, that's Justin, Matt, maybe. I can send you Justin's contact information.
Yep.
You can remove, again, when it comes to removing the provider from the provider list, I would speak to support about it. They'll walk you through that. I don't want to just give you some very, very quick 2-second information and do damage. So call support about that. Yeah, Google review through Wire Clients you can do. Is there a way to merge duplicate clients? No, but it's something we need to work on because it's happening all the time. There's another interesting thing with 636, by the way, the new build is you can actually transfer payments between clients. So if one client's paid for another, like a family thing, you can do that. But we do need to get into merging clients as well. Anyway, I think that is about it. I apologize for the bit of a rush there at the end. And again, drop me an email, drop Matt an email, drop support an email, and keep the ideas coming. And we're happy to hear from you guys. So thanks very much.
Thank you, Steve. Thank you,
Take care.
everyone. Take care.
Bye.